You know, the world of frequency medicine can feel like the Wild West, right? On one hand, you've got the FDA giving the green light to devices like Optune packs, which literally uses electrical fields to fight cancer. But on the other hand, you're flooded with all these unregulated wellness gadgets that claim to do, well, pretty much everything. So how in the world do you separate the breakthrough medicine from the pseudoscience? That's exactly what we're going to break down.
So here's our game plan. We're going to cut through the noise. We'll start by looking at the whole spectrum of these devices, then we'll get really specific on what frequency-specific microcurrent, or FSM, actually is. We'll put it head-to-head with bioresonance, figure out why the regulators care so much, and finally, land on the one key difference you need to remember: the tool versus the cure.
All right, so first things first, it is absolutely crucial to understand that not all frequency devices are created equal. I mean, not even close. The term covers everything from these super rigorously tested medical machines to, experimental gizmos you can buy online with zero clinical backing.
And this slide, wow, this just lays it out perfectly. On the left, you've got Optune packs. This is a prescription-only, highly regulated medical device that went through the toughest FDA reviews with tons of clinical trials to back it up. Then on the right, you have something like a Rife machine. This is based on a theory from the 1930s, and it's sold directly to people as experimental, with absolutely no FDA approval to treat any disease. One is medicine, the other is, well, it's just a claim.
Okay, so now let's zoom in and talk about a technique that lives in a really interesting clinical space. It's called frequency-specific microcurrent, or FSM for short. Now, this isn't some magic box. Think of it more as a highly specific tool that only trained practitioners know how to use.
The key phrase to lock onto here is microamperage. We are talking about currents that are so low, they're actually in the same ballpark as what your own body produces naturally. See, the idea isn't to shock or force the change. It's more about resonating with specific tissues, like a particular nerve or a muscle, to kind of give them the energy they need to calm down inflammation and speed up healing.
And this is where it gets really fascinating. This is how practitioners use FSM for something they call differential diagnosis, which is really just a fancy way of saying it's a process of elimination. So look at step 1. A practitioner thinks, maybe this nerve is inflamed, so they apply that specific frequency. Step 2, they're actually feeling the tissue with their hands. And if step 3, it immediately softens, that's a huge clue they're on the right track. It helps confirm their initial thought in step 4. But if nothing changes, well, then they know to start looking for a different cause, maybe something like scar tissue instead.
This digital stethoscope analogy is just perfect. Think about it. A stethoscope doesn't diagnose anything by itself, right? It just lets a doctor listen for clues. It's the same idea here. An FSM device gives a trained practitioner real-time feedback directly from the body. It lets them listen to the tissues and use that information to piece together these really complex cases, especially when an MRI or an X-ray comes back showing nothing's wrong.
All right, so now let's flip the coin. Let's contrast all of that with bioresonance, because this is where the claims change, and I mean they change dramatically. We're moving away from a practitioner's feedback tool and into something else entirely.
This table gets right to the heart of it. Just look at that first row, how it diagnoses. FSM helps a practitioner confirm an idea if the treatment they're doing actually works. Bioresonance, on the other hand, claims it can automatically scan your body and just name diseases. The mechanisms are totally different too. FSM uses a real electrical current to create a physical change you can feel. Bioresonance claims to read these abstract signatures. And this difference right here is why FSM is used in clinics for things like pain, while bioresonance is pretty much considered pseudoscience by the mainstream medical world.
So the big question is, why do regulators like the FDA treat these two things so differently? Well, it all comes down to one thing: the danger that comes with making unsupported diagnostic claims.
Okay, let's be crystal clear here. FSM devices have a very specific, very narrow FDA clearance as a TENS unit. That's a device for electrical nerve stimulation for pain relief. And that is it. They are absolutely not cleared to diagnose any disease. The diagnostic part is what's called off-label use by licensed practitioners. Bioresonance devices, on the other hand, they have no FDA clearance, no approval for anything, period. They exist in a totally unregulated space.
And this is why this whole thing matters so much. When you make unproven diagnostic claims, you create serious risks. The real harm isn't that a device might give you a little zap. It's that someone with a serious illness might chase after this unproven tech, delaying or even avoiding proven medical care that could actually help them. This medical distraction is the #1 danger. It allows a serious condition to get worse, sometimes until it's too late. That's what regulators are trying to prevent.
So that brings us to our final, and honestly, the most important takeaway from this entire discussion. This is the simplest way to tell these two very different worlds apart.
And there it is. It's that simple. One is a tool, like a stethoscope, that needs a skilled human to listen and interpret the feedback. The other claims to be the expert. It claims to be an automated machine in a box that cuts the practitioner out of the loop entirely. FSM empowers a clinician's judgment. Bioresonance claims to replace it. So we end on this question. As our technology gets better and better at getting feedback from our own bodies, that line between a sophisticated listening tool and an automatic diagnostic machine, it's only going to get blurrier. Understanding the difference between a tool that informs an expert and a machine that just makes a claim, that is going to be the most important skill you can have as you navigate this new frontier of medicine. Thanks for tuning in.